Good afternoon. This is Jack Mackinson. This is a video of my what I call level 2 first aid trauma kit. Now this contains a lot of first aid supplies, trauma supplies, in case I come over something that's traumatic or anything like that. So what I'm going to do is I'm going to start on this side and pull out the things that I have here. Okay, we got some, I carry gloves with me. And this is a medication pack I have, and it contains everything from Tylenol, aspirin, and things like that for medication. So I'll lay that down there. And then the other thing I have here, this is called Narcan. Narcan is for somebody that's overdosed on narcotics or opiates, and this will bring them back. It's a nasal spray, and if someone did you suspect of being overdosed with opiates or narcotics, you can use this to help them revive them. Okay, that's that there. And just as a regular thermometer, it's a digital. Okay, now let's go over to the other side. Now this is for trauma, and I'm going to pull everything out and show you what it's like here. Okay, this is called a Celox. It's called Celox A. And what this is a syringe that has a hemostatic agent in it. And if you come across someone that has a severe bleeding, you can inject this Celox A, and will help prevent any further bleeding. That's that. Okay, this is called a Celox. Well, it's not Celox. It's an emergency bandage that you can compress over any kind of bleeding wound or puncture or anything like that. And you wrap this around the wound, and it helps compress the wound area to prevent it from any further bleeding. Okay, let's see what else we got in here. Another pair of gloves. Okay, the other thing I have in here is called Celox. Celox is a hemostatic agent, and you put this in the wound, and it will help clot the bleed and prevent it to bleeding any further. Okay, last thing on this side. This is called Celox X gauze. Now, if you have a severe bleed and on your body from a gunshot wound or a knife wound, and this is a gauze, and it's you pack this into the wound area, and what that will do is help promote clotting, so it won't bleed any further than it already has. Okay, that's it for the side bag. Okay, now we're going to go over into the main compartment. Okay, the first thing we have here is a compartment I keep with gauze pads. These are 4x4s and 5x9s, and these are used to stop the bleeding if you need to. Serge pad. And then here we have just the regular bandages for your typical nicks and scrapes. Okay, so that's that. Now we'll move over to the main compartment. what I do is I unfold it to reveal it. And over here on this side, I have tweezers, both pointed and slanted, in case I need to pull a splinter out or something like that. So that's over here. Okay, over in here in the main compartment, I have this thing. It's called a Curad, Quick Stop, and you can spray this on a wound, and it will also coagulate and keep it from bleeding any further. And over here we have just a regular light, flashlight, so I can see what I'm doing in the dark. You can see how bright that is. Okay, that's it. Okay, what else we have in here? Let's see. Okay, this is Neosporin to go. Now, this is an antibiotic, and you use that, and you can spray it onto the wound, and it will help prevent any kind of infection and things like that. I also have a tube of cortisone 10 for itching. It's kind of like Benadryl, but it's high-powered, so that's that. Over here I have another tube of, excuse me. This is triple antibiotic ointment, and I put that on a wound to promote any kind of bacteria or anything that might occur during that time when you need to save some skin and tissue like that. Okay, over here we have, it's called Coban. This is a wrap that's self-adhering, and you can wrap a wound with that, and it's self-adhering, so it's pretty good for that. There's another one I keep too. Let's see what else we got in here. Another partial Coban wrap, and this is Transport tape. It's made by 3M, and this is probably the best adhesive for taping dressings onto wounds, and it's breathable, so it's really great stuff. Okay, the last compartment. What do we got here? Oh, this is just a prep pads. It's got a Providone. Providone pads, and also some alcohol pads in there as well. Okay, let's move on. Oh, these are just alcohol prep pads. Okay, what we have here is tincture of benzoin. You clean a wound, and then you put this out of the perimeter of the wound, and it helps to adhere the gauze pad, and it's antibiotic as well, so we use that as well. Okay, here we have saline eye wash. We use this to flush a wound or an eye that if you have something in your eye, you can use that to flush it out, and it works pretty good. Okay, here we have burn gel. Now, if I come across a patient that has severe burns, I can put this on there, and it relieves the pain and it soothes it. So this is very good for burn injuries. And then what we have here is I've got some antibiotic ointment, single use. So I use that to put on a wound as well to prevent any kind of bacteria. And last but not least, I have it's a Mylar rescue blanket, and you can put it over someone that's in shock, and it helps retain temperature for someone that's like in shock like that. So that's it. That's what the kit consists of. And I hope you enjoyed it. If you have any comments, please leave them below. Thank you.